If you have a question that needs special attention, we have the answer, because today we're asking the specialists about your biggest concerns. And right now, we'd like to welcome dermatologist Dr. Jeremy Green to our show. Thanks for being here, Dr. Green.
Thank you so much. It's an honor.
And we've got a question on our Facebook page that I think will be perfect for you. It's from Megan, who writes, I've had rosacea for as long as I can remember, and I feel like I've tried everything. Will any treatments get rid of it once and for all? You know, the first thing I would ask, Dr. Green, is rosacea something you're seeing a lot of?
Definitely. Every day in clinic, I see patients with rosacea, which is characterized by flushing, redness in the skin. Sometimes people get little bumps or bumps filled with pus called pustules, located in the cheeks and over the nose.
And a lot of people are trying to treat it. They're having trouble with it.
Yes, unfortunately, there is no cure, so it's a chronic inflammatory condition. First thing I tell my patients is to avoid triggers, which unfortunately are some of the finer things in life, like alcohol, spicy foods, caffeine, sun. Avoidance of triggers is very important.
You have a treatment option that is something you can do in just one day?
Yeah. My go-to is the Cutera XLV laser in my practice, and I think we have some footage of that. This is me with a patient in my practice down in Miami, and basically you can see the vessels go away instantaneously. It's very gratifying. We can trace the vessels away. It's almost like a paintbrush. And if there's a friend or family member in the room, I ask them to come up at a safe distance to observe the treatment, because it's kind of one of those wow moments as the blood vessels go away.
Then as far as once that's done, what's the long-term prognosis then?
So unfortunately, we're treating kind of the end result of the condition. We're not treating the condition itself. So the patients may have to come in again in 6 months or a year for an additional treatment, because they're still going to be flushing and getting those tiny little blood vessels.
And what's cool here is whether it's rosacea or some other skin problem, you may try one treatment, you may try another, but there may be another option, so ask your specialist. We do also have a video question that I think is right up your alley, so let's see it.
I have hair growing in places a lady should never admit to having hair. I want to have it removed. I'm considering laser hair removal, but I heard that laser hair removal affects dark skin differently. Is that true? And what are my options here?
I was asked, lasers work very differently with people with darker skin, yeah?
Yes, it's very important. To kind of describe that better, I'd like to show you guys the model of the skin. So what we see here is kind of the outside world. The sun, the outside world, this is a side view of the skin. This is the epidermis, the outermost layer, and then the next layer down is called the dermis. Between those two layers is where pigment resides, on those kind of little hills and valleys. And people that are fair like me have a little bit of pigment, but people who have pretty darker skin have a lot more pigment there. And the way that laser hair removal works, you can see the large hair here, is that it targets the pigment in the hair shaft. So light literally goes through the skin, targets the pigment in the hair shaft, the light's converted to heat, and the heat knocks out the stem cells that are making the hair shaft. So as you imagine, if you have pretty pigment in your skin, that can be problematic, because the laser light doesn't know the difference between the pigment in the hair shaft that we want to get rid of and the pigment that's baseline in your skin. And that's how people can get burned. And there are certain wavelengths of laser that are safe in darker skinned people, because the laser penetrates deeper before delivering its energy, so the energy is focused on the hair follicle.
I think before we go to break, we have to emphasize this. I think a lot of people, because we talk so much about lasers, think that anyone can handle a laser, can't do damage. These lasers are really powerful, very important to make sure you're getting the right laser, the right person doing the treatment.
Somebody does use it a lot, and
there are some people out there probably firing up these lasers who don't know what they're doing.
Yeah, unfortunately, we see a lot of those patients in our clinic who go to these kind of laser factories, and then once they've had an unfortunate consequence, a burn or something like that, pigmentation, they come to us. So I always tell my patients, you know, if you're going to be reasonable, it's a good thing. Buy clothes on sale, do things like that, but you only have one body, you only have one skin, so treat it well.
Dr. Green, thank you so much.
Yes, sir. Thank you so much for having me on. Thank you.
And coming up, a common heart condition.